Myself Prabhakar, Associate Professor, Department of Pharmacology. Today we'll discuss about coagulants. So before going into the coagulants, let us discuss about the blood coagulation process. Okay, so blood coagulation is a vital physiological process which prevents excessive blood loss following a vascular injury. So everyone knows that vascular means blood vessels, which involves a complex series of events known as coagulation cascade. So, the coagulation cascade is intrinsic or extrinsic pathways converging into a common pathway to form the fibrin. So, the final product will be the fibrin, which will be forming as a clot. So, what are the coagulants are used to? So, coagulants are substance. So, this is the definition. So, coagulants are substance which promote the blood coagulation. This is known as clot formation by accelerating the conversion of blood from liquid to a semi-solid state, which enhances the clotting cascade, leading to the formation of fibrin, which stabilizes the blood clot and prevents the further bleeding. The following are the uses of coagulants, which controls bleeding, prevents the hemostasis in injuries or surgical procedures, treats the coagulation disorders such as hemophilia, enhances the wound healing process, promoting the clot formation, reducing blood loss during trauma or invasive medical interventions. They may act to different mechanisms like supplying clot factors, promoting platelet aggregation, causing vasoconstriction, or acting locally to form a mechanical barrier. Examples are topical hemostatics. So these are the general aspects of the coagulations that we have to keep remember while studying this topic. Next, we move on to the mechanism of blood coagulation. So, this is how the blood coagulation exactly happens. There are 10, sorry, there are 12 clotting factors with which the blood clots. There are two pathways generally, intrinsic as well as extrinsic pathway. So starting from the intrinsic pathway, the internal bleeding stops with the help of starting from surface contact of 12 and 12A factors, and then 11 will be converted to 11A. 11A will assist in conversion of 9 to 9A. So again 9A will assist for conversion of 10 into 10A and then to 10. So finally the 10A will assist the prothrombin to thrombin conversion. So prothrombin to thrombin conversion is also assisted by calcium factor, and then the thrombin will be formed. The thrombin will convert the fibrinogen into fibrin. Then these are the steps, and then extrinsic pathway, the general external tissue damage. Tissue factor 7A will convert the conversion of 10 to 10A, and the following steps are same, similar to the intrinsic pathway, which will lead to the conversion of prothrombin to thrombin. Again, thrombin will activate the 13th factor to 13A to form the stable fibrin clots. So generally, so these are the difference between the intrinsic and extrinsic factors. Both are involved in the clotting only. So we can see the factors here. 12 is H1 factor, serine protease, and 11 is a plasma thromboplastin antecedent serine protease, and 9 is Christmas factor, serine protease, 7 is stable factor, which is also known as serine protease, and 13 is fibrin stabilizing factor, a transglutaminase. So PL means platelet membrane phospholipid, Ca is calcium ions, TF is tissue factors. So these are all the factors involved in clotting mechanisms. Let's move on to the classification of coagulants. So we have several classifications. First, we'll discuss about the systemic coagulants. So systemic coagulants are nothing but they are act through the bloodstream generally. So vitamin K and analogs, natural and synthetic forms are there. So examples of vitamin K1 and K3. So K1 is known as phytonadione and K3 is menadione. And mechanism of action is, as we discussed previously, clotting factor preparations like are used for replacement therapy, factor 8 and factor 9, fibrinogen. So these are the direct replacement of missing clotting factors, which will be highly useful for the conditions like hemophilia A and B. The vitamin K analogs are generally useful for the vitamin K deficiency or warfarin toxicity. Next, we have the class of known as antifibrinolytics. Generally, the plasmin inhibitors, we call it as. Generally, they are tranexamic acid and aminocarporic acid. The mechanism of action is the inhibition of plasminogen activation to prevent the fibrin breakdown. So generally they are for trauma or surgery. So next we have the vasoconstrictors, generally sympathetic mimetics we call it this. So drugs are adrenaline or epinephrine, so which reduces the blood flow by constriction of blood vessels and bleeding. Next, we have the topical anticoagulants. Generally, they are thrombin preparations, mechanical chemostatics, and astringents, fibrin serums, etc. So, thrombin preparations are direct acting enzymes. Examples of thrombin converts the fibrinogen to fibrin directly, which is used to prevent the surgical bleeding or topical use. Mechanical chemostatics are absorbable matrices, gelatin sponge, collagen or oxidized cellulose, which provide the scaffold for clot formation. It is used for wounds, dental extractions, and then we have astringents, generally the protein precipitants we call it as. So we have alum and tannic acid, which are helpful for precipitation of proteins, which seals the capillaries, and they are useful for the minor cuts as well as epistaxis. Fibrin sealants, generally biological adhesives, fibrin glue, mimics the final step of coagulation cascade. So generally they are useful for the surgical procedures. Okay. So next we have the mechanism of action of anticoagulants. Sorry, coagulants generally whenever there is a vascular injury, the vasoconstrictions is a general immediate response to reduce the blood flow. So these factors, the drug adrenaline will enhance the vasoconstriction process. Second is platelet adhesion or aggregation, which is the initial platelet plug formation, which is assisted by gelatin or collagen, which is taking place on the platelet surface. Next, we have the coagulation cascade activation, which will activate both intrinsic as well as extrinsic pathways. We have vitamin K and the clotting factors, direct replacement therapy for this purpose. Next, the final steps are thrombin formation and fibrin formation. So finally, this baby clot will be formed. So for fibrin formation, topical thrombin is essential, direct thrombin formation, and also we have fibrin sealants as we discussed in the last part of the classification. And the stable clot is assisted with tranexamic acid, which prevents the fibrin breakdown as a part of plasmin inhibition. So this is the mechanisms of action of various coagulants. So these are all the general adverse drug reactions of coagulants. Generally, all these drugs will cause the local irritation and the site pain at the site of injection, and also sometimes allergic reactions may be triggered, and then the general reactions like nausea, diarrhea, palpitations are common in vasoconstrictors, and for topical thrombins, local irritation and allergy is common, and we have infection on foreign body reactions, as well as the astringents will cause local irritation, fibrin serums will cause allergy or embolisms. Okay, so these are all the adverse drug reactions of coagulants. Thank you.